We keep talking about a historic day. For a little perspective on that, it's worth remembering that in a sense this has been 77 years in the making. In 1935, it was Franklin Roosevelt who first tried for a national health care bill, but fell short. He could only get Social Security. And then President Lyndon Johnson in '65 gambled big and lost. He added Medicare, though. And then we remember First Lady Hillary Clinton, who tried and failed, and today she said she was very pleased with the Supreme Court decision, calling it a great moment. Time now to bring in Good Morning America co-anchor, anchor of This Week, George Stephanopoulos. So, George, we heard what Governor Romney is saying he wants to do the minute he is elected, if he is elected. Does this mean this can still be stopped?
It sure can, but it's not likely, and it'd be very difficult to do. We've seen Social Security and Medicare have endured for 77 and 50 years. But here's what can happen. Number one, if Mitt Romney gets elected, keeps the majority in the House, and gets a supermajority in the Senate, he could repeal. Now, that's very hard. It's unlikely to see him getting 60 votes in the Senate, but he can, by executive order, give states the ability to opt out of the exchanges. He can delay implementation of the fines or the mandate, and he can also refuse to fund the subsidies. So he can slow it down if he gets in. Hard to fully repeal. Almost
impossible to repeal, even if he's elected. So let's talk about the campaign to November. What difference is this going to make?
I think it's going to galvanize Mitt Romney's supporters who are opposed to the health care law. No question about that.
Already weighing it with money.
And it will energize President Obama's base as well, and give him that second chance that Jake was talking about to sell the popular provisions of the bill, which he wasn't able to do over the last year and a half. But my gut tells me, Diane, that over the next 5 months, this is not going to matter all that much in the election. Both campaigns know that the economy is far higher on people's concerns than health care, and that's what they're going to want to talk about.
All right. Well, it's not often we say it is a big day, an historic decision. This truly was, and we thank you, George, and the entire team.